I'm Edmundo Gonzalez, the CEO and co-founder of Marpai Health. At Marpai, we are developing a smart health plan administration system. What does that really mean? Well, it means we're really creating the healthcare payer of the future. We're employing the latest developments in artificial intelligence. It's a discipline called deep learning. And we're using all of these wonderful technologies really in two ways. First, we are creating the most efficient payer in the market. What that means is that we are able to administer healthcare claims much more efficiently than our competitors. We want to take the cost of administering a claim to about 1/3 of what it is right now. And we're going to do that in the next several years, not in the next decades. We're doing that by employing all of these technologies to get a lot of automation in the processes that right now are quite manual. Now that's one important piece. And what that means for our clients is that they're working with a super efficient technology company to really process their claims in a brand new way that leads to less fraud and abuse, less waste, and a lot more efficiency with their money. It's an important piece, but it's only the beginning. The second piece is really prediction. And prediction means that we are partnering with members, that is the people receiving healthcare benefits, to give them a sneak peek into their future. This means that we can predict who in the member population is on a journey to have a chronic condition, or who's on a journey to have a very high cost surgery. We don't stop there, that's only the beginning. Engagement is also part of what we do, meaning it's not enough to know who is going to be sick or who's going to have a high cost event, but we do something about it, meaning we have a whole platform that engages with the member, provides the member with the appropriate care, but also provides nudges and reminders for that member so he or she can actually act, take control of his or her own health care, and act on our alerts. Now, why do we want to know that? Why is that important? Well, first of all, chronic conditions account for about 2/3 of all healthcare spending. And a lot of these conditions are treatable, in some cases even preventable. So knowing who's on the journey early on allows us to then match that member, that patient, to the best and most appropriate care. This is what saves lives, but you know what? It also saves money for both the patient who contributes to his own healthcare spending, and of course for the employer, our client, who foots the bill for most of the healthcare claims. In the case of high-cost surgeries, we're also matching those members way early, 6 months, 4 months before a surgical event, with a list of the best providers. We call this Top Care. Top Care allows us to match members with the best possible providers. We know that the best providers have the best outcomes. That means less readmissions, less visits to the ER, of course, less pain and suffering for our members, but also ultimately lower costs for everyone. This is what we're about. So these two pillars, essentially creating the most efficient payer out there on the one hand, and being able to not only predict, but to interact with our members as a second pillar, these two things together are our mission. This results in really a high margin company that has a very, very highly differentiated platform. And of course, this is poised for high revenue growth. We have created Marpai Labs, which is our R&D facility. At Marpai Labs, we're able to gather millions and millions of points of data, from healthcare records to medical claims to social determinants of health and other data points that help us create a whole family of algorithms. The algorithms essentially give us the power to predict which members are on a journey to develop a chronic condition or which members will have a high-cost event. Currently, there are 8 algorithms that our members are using and getting benefits of. We are developing dozens of these algorithms targeted at not only chronic conditions, but other high-cost events. In the months and years to come, we will be able to better predict who will be sick and who is on a path to have another high-cost event. For example, a knee replacement or a rotator cuff replacement. We're doing this so we then can match those members with the best care. The best care not only limits human suffering, but also saves cost. To find out more, please visit marpaihealth.com. Thank you.